Thank you so much, Zawar, for having me today. And thank you for that introduction. Yes, I am a full-time dad, and I feel like that's my main job, and this is what I do in my spare time. So I'm going to share the screen, and please give me a thumbs up. Zawar, I can see you. So if you give me a thumbs up, then I know you can see it. Fantastic. So thank you everyone again for having me today. And I was glad I kind of joined the previous session towards the end because some of the discussion I could definitely shed a little bit more light on as well. So I'm coming to you from the Ontario Caregiver Organization, and my role there, as War mentioned, is as a regional lead. So that's just a fancy way of saying that I connect with organizations as well as caregivers on the ground to kind of understand perspectives around what caregivers are experiencing and see how we can take those perspectives, take those caregiver voices, and make sure that we are able to work towards filling some of the gaps and needs that are identified by caregivers and service providers on the ground as well. So, a little bit of background around who we are. The Ontario Caregiver Organization, OCO, we are a relatively new organization. We've been around for about 4 years now, and we are sorry, we aim to be that agency that kind of supports caregivers regardless of where they are in the province, regardless of who they're taking care of, and regardless of their age. So we want to be that one-stop shop for information and supports for caregivers across the province. And I'll talk about who we define, how do we define caregivers as we go along as well. Um, so primarily we work with caregivers and we work with the service partners, system partners, and the general public to kind of improve the awareness and recognition of the contribution and importance of caregivers and the value that caregivers bring to our healthcare system. So based on where you are in the country, we know that caregivers contribute from anywhere from 26 to $72 billion worth of healthcare funding. So that's a lot of value that caregivers bring to our healthcare system. And huge part of what we do is try to work with caregivers and work with the general public to make sure that caregivers are recognized for that role. We also aim to connect caregivers to information and support. So I talked about this, so regardless of age, condition, or location. So anywhere in the province, we work with young caregivers as well, and caregivers who are older and are supporting other family members as well. We also wish to work with system partners to make sure that partners that are close to each other are having discussions and speaking with each other, and then so that we can kind of stop those silos and trying to bridge gaps between service so that caregivers can easily transition between one agency to the next. So we heard from a lot of caregivers saying that it was a monumental task when switching agencies, when trying to find services from two different agencies. So we thought, hey, there are great subject matter experts and service providers out there. So we should really work with them to kind of fix that and bridge those gaps and decrease those silos as well. And then we also work with caregivers to identify gaps in service needs. So we know that caregivers are subject matter experts themselves. Their lived experiences speak volumes. So we want to work with caregivers to identify what those pain points are, identify what those gaps in service are, and then be able to take that to the decision makers so that future funding and future programming that comes down the pipeline is reflective of those gaps in needs and service as well. So we define family caregivers as any family members, friends, or neighbors, and it's perfect because we're part of the Neighbors Project right here, who provide care for someone in an unpaid capacity, and that could be due to any of the reasons you see on the screen right there. More recently, because of COVID-19, we're seeing that there are a lot of new caregivers entering the fray because of complications as a result of COVID-19, and somebody who may have had minor issues prior to the pandemic, but now because of COVID-19 has become more exasperated. So now we're seeing that they're taking on more and more heavier caregiving responsibilities. So when we're looking at caregivers across the province, we know that there are about 4 million caregivers across Ontario, which includes young caregivers, primarily within the age group between the age of 36 and 65, who also identify as being part of that sandwiched generation, as in they're sandwiched between taking care of someone older while also having responsibilities towards younger individuals at home. That number you see on the screen that says 12% for individuals over the age of 65, that number is slowly but steadily on the rise. We know that folks are living longer, and we know that a lot of older adults are taking on a lot of caregiving responsibilities towards their spouses or partners, or towards their friends who might be older as well. So that number, 12%, is also on the rise for individuals over the age of 65 taking on caregiving responsibilities. Unsurprisingly, more than half of caregivers are women. And we also know that there are about 69% of caregivers who are employed. But during the pandemic, there's been a gradual shift in terms of full-time employment to shift-based or part-time employment, because caregivers have said that it's become more and more challenging balancing their caregiving responsibilities with their work responsibilities as well. So when we're looking at who they're caring for, so most are caring for one person. However, there's 1 in 5 who are taking care of more than one person. So this could be the caregiver who's part of that sandwich generation that we talked about, or it could also be a primary and secondary caregiver. So if you're thinking about it from a father, mother, daughter dynamic, for example, the mother might be the primary caregiver to the father, while the daughter might be the secondary caregiver to the father, but also be the primary caregiver to the mother, because the mother comes with her own set of ailments as well. So we're seeing a lot of these dynamics take shape all across the province, recognizing that there are a lot of individuals who are taking care of more than one person as well. When we're looking at it in terms of responsibility, more than 50% of caregivers say that their top responsibility is to provide emotional support to the care recipient. Other responsibilities include things like behavioral support. For example, if there's dementia involved, it could cause responsive behavior. So they're offering ways to mitigate that behavior. For example, they offer physical support such as lifting and moving. They offer basic medical tasks such as administering medications. But now, because of the pandemic and all the closures and the restrictions where professionals maybe are not able to come into the home, a lot of folks are taking on complex medical tasks as well, such as administering, giving injections, changing wound packages, changing catheters, and a range of different services that a professional would actually be doing as well. And then we know unanimously that caregivers also provide a lot of personal care, such as bathing, changing incontinence products, etc., in the home as well. Uh, COVID-19 has really hit, if I can use that word, caregivers a lot harder than the general population as well. Unanimously, caregivers say that they've experienced increased financial hardships during the pandemic because of all the extra cost of caregiving 24/7 at home. And what that has also resulted is caregivers are experiencing disturbed sleep patterns, which has caused an increase in caregiver burnout. And unanimously, we see that across the board, across the province, these are the pain points that have been identified by caregivers as areas where they need additional support as well. So what do we do? What do we do in response to these caregiver pain points? We have primarily as a great starting point, especially for newer caregivers, we have a toolkit called I Am a Caregiver Toolkit. So this toolkit really informs caregivers around what it means to be a caregiver and what you can expect throughout your caregiving journey. The toolkit offers a worksheet that helps caregivers build a support team. So there are instances where you're having a conversation with a family member, friend, neighbor, and they say, hey, let me know if I can help in any way. So that's a great opportunity to kind of pull out the worksheet and say, hey, these are the different activities I take on as part of my caregiving responsibilities. And, maybe you can help me with X, Y, and Z. There's also a self-assessment tool as part of this toolkit that really helps caregivers do a self-assessment on how they're coping emotionally throughout their caregiving journey. It's really important that caregivers understand that stress and burnout come hand in hand with caregiving for a lot of caregivers. So it's really important that as the caregiving journey changes, as responsibilities change, and as caregiving becomes more demanding, that they take this self-assessment to see how they're coping so that they can take steps on their own end to better take care of themselves, right? So think about it from the airplane analogy. You first put the mask on yourself before you put the mask on someone that you're helping. So essentially, you have to be better able to take care of yourself. And I know that's for a lot of instances easier said than done, but we have a lot of tools that can help caregivers through that process as well. Another toolkit that we introduced recently in partnership with the Canadian Mental Health Association is the Balancing Work and Caregiving Toolkit. So from responses during the pandemic, we heard from caregivers saying that they found it difficult managing work and care. So we created this toolkit that allows caregivers to kind of look at 5 ways to better make it work at work. So the toolkit encourages caregivers to have meaningful conversations at work with their managers and their employers so that they can better understand what it takes to be a caregiver and take steps at work to make your workplace more caregiver friendly. So if you're looking to do a deep dive on how you can be more productive at work while also being a productive caregiver, I encourage you to take a look at this to get this toolkit. And if you have any questions, you can feel free to reach out to me as well. I will make sure to send this slide deck out to Zawar with my contact information in the end, so you can reach out to me at a later point as well. And then our website offers a range of different resources, such as tip sheets and resources for specific populations. And based on the previous question that I heard before the presentation, we have information around different financial supports that are available for caregivers as well. As you can imagine, we get asked a lot of questions and we get reached out a lot around what kind of financial supports are out there for caregivers. So we have a web page that is dedicated to all of the different financial options that are available either federally, provincially, sometimes based on the municipality, or sometimes even locally through different local organizations that might have funding for caregivers as well. So feel free to go to this website. The last point you see on that screen there, the tax credit for family caregivers, is something that's offered by the Canadian Revenue, CRA, Canadian Revenue Agency. If I'm, yeah, I don't know why I mix that up. But you can go and check out what tax credits are available for family caregivers through that link right there. So all of these points are linked on the website, and you can go and access them. On a more public-facing front, we have a podcast that's available through Spotify, Google Podcast, Apple Podcast, that offers insights into what it means to be a caregiver. So it's a space where we invite experienced caregivers as well as subject matter experts to lend their voices to talk about topics that are meaningful and that matter most to caregivers themselves. So topics such as managing relationships, getting a good night's sleep, managing money, navigating the healthcare system, caring for someone with an addictions challenge, with a mental health challenge, what cultural differences may arise during caregiving, and what to expect. So these are topics that that caregivers and subject matter experts have discussions on, and you can download them through any of those major podcast providers, and you can listen to it at your own time as well. I should mention, everything we offer at OCO is free of cost. We don't have any cost for any of our programs or services. Most recently, we also launched our 90-second caregiver letter. So we heard from a lot of caregivers saying that most of the time when they reached out for information around caregiving, they were given either lengthy journal articles or just other information that had a lot of technical jargon in them, and they were not really able to understand it or didn't have time to read through lengthy articles, right? So we reached out and we partnered with a Canadian clinical psychologist whose name is Dr. Patrick McGrath, whose team specializes in creating succinct, accurate health information for caregivers. So as the letter suggests, it's a 90-second caregiver letter, so you can read within 90 seconds, which gives you information on different topics each week. And based on those topics, you can click on additional information, testimonials, and action items that you can do to better get information around that particular topic. I know I received one today around managing relationships and keeping all communication tabs open with family and friends. So you can sign up for the English or French version based on your interest, and you get notified weekly, once a week, around the different topic areas, and you can find out more based on your interest there or not as well. We also have webinars for caregivers based on these 4 thematic areas. So around caregiver well-being, financial and legal tips, advanced care planning, and caregiver skills and development. So we host webinars about twice a month, and you can access them through our events page. So if you go onto our website, on the right-hand side top corner, there's an events tab. You can click on that and see what upcoming webinars are happening in the month of November or December, and you can sign up for those webinars as you like. If you've missed any of our webinars or you want to go and check out our previous webinars, please feel free to go to our webinars page, and you can go and find all of our previous recordings on there as well. So with the aim to be that one-stop shop for information for supports for caregivers, we established the Ontario Caregiver Helpline as well. So again, going back to working with subject matter experts, we partnered with 211 because they already had a database, and we trained staff at 211 to be community resource specialists who work as part of the Ontario Caregiver Helpline. So when you do call the helpline, the specialists are trained to respond to caregiver-based inquiries and offer supports based on that inquiry as well. The helpline is strictly a system navigation tool, is less of a crisis intervention tool. However, if someone does call and presents with a crisis, there are internal referral mechanisms in place to make sure that the person is connected to the appropriate clinical services as well. The helpline is available in English and French, but also offers interpretation services in 150 different languages as well. So if you're looking to get services in, I'm going to pick a language in random, Bengali, you can request interpretation services in Bengali and they will find it for you as well. Next, we have, on a more clinical lens, we have a program called SCALE, which stands for, if I'm going to get this right, Support for Caregiver Awareness, Learning, and Empowerment. Great. So what that really means is it offers tools and offers practical skill sets for caregivers to better take care of their own mental health needs. So this is broken down into 2 4-week sessions. We run this live twice a year. As you can see, we just finished on November 2nd, the fall version of iteration of this program. We will start, I think, in February, the next cycle. But in the meantime, if you go on to each one of these topics and you click on them, you will see a recording for the most recent iteration, and you can access these recordings as well. What's unique about the live webinars, though, is that once someone registers for either session 1 or session 2, and they participate in a webinar, then they can sign up for either the individual or group counseling sessions as well. There is a screening process to make sure that the person is a good fit. And if not, then there are, again, internal referral mechanisms in place to make sure that they are guided to a caregiver coach who can find them more appropriate clinical services based on where they are as well. So these are 8 psychoeducational webinars, and caregivers can sign up for all 8, but really participate in that 1 or 2 sessions that they want to get more understanding on or want to reflect more on further as well. We also have a program for young caregivers. So we had a lot of these programs and where young caregivers were also joining, but we heard from a lot of young caregivers saying that they were not really resonating with some of the discussion that was happening in these generic groups. So we created a sister site called Young Caregivers Connect, where young caregivers between the age of 15 and 25 are able to go on and access content that is relevant to a young caregiver. The forums are all run by peer mentors, young caregiver peer mentors who are trained by OCO themselves, and are a safe space for young caregivers to come together and have discussions on things that matter most to them. We as OCO staff are we overlook only on the operational side of things. And if there is additional help required, then our young caregiver project lead kind of steps in to make sure that the person who needs that additional help gets the help that they require as well. So I know I said between 15 and 25, but it's not hard and fast. I mean, if there's someone 26, we would definitely invite them to be part of that group as well. We also offer e-learning opportunities for caregivers. You can go onto our e-learning platform and create a username and password and access all of these different courses. So the Caregiver 101 course, again, is a really great beginner course to understand more around what is caregiving, what conflicts may arise, what is burnout, how do you mitigate burnout, and a range of different information as well. The Caregivers Partnering with Healthcare Professionals is a course that speaks to how caregivers are need to be involved in within the circle of care and need to be consulted, and it gives caregivers practical steps on how to speak up at a doctor's appointment, for example, and make sure that they are heard and that they are consulted when it comes to creating a care plan for the person that they're caring for. If you really think about it, caregivers are integral to making sure that either social or medical prescriptions are being filled. So it really allows caregivers to give different strategies on how to be better heard at a doctor's appointment, for example. And then the third one, roadmaps to caregiving, the realities of mental illness and addictions, is specifically for caregivers who are taking care of individuals with an addictions or a mental health challenge, and it talks about the caregiving realities associated with those challenges as well. We also offer peer supports, so from group peer supports virtually to individual one-to-one peer supports as well. So if there's a caregiver who's looking to get more one-to-one support from someone who's gone through something similar, we have caregiver mentors who are experienced caregivers themselves who offer that one-to-one peer support as well. So if you're looking to be a one-to-one peer support, a mentor, or if you're looking for that one-to-one support, just go to that website at the bottom of the page and you can sign up to be either or as well. And then we work across the board with system and stakeholder partners as well, from the Ontario health teams all the way down to grassroots organizations and faith-based organizations as well. We offer learning and education opportunities for professionals. We offer tools and resources for professionals on how to better engage with caregivers. We offer different collaboration opportunities such as this, for example, or if there are other programs that organizations want to run on their own, then we kind of help them build and scale those programs as well. And then we offer guidance and support on building and scaling caregiver programs based on where they're calling from as well, or where the organization is based out of. We have a care provider resource center, which has tons of tools on how to better engage and work with caregivers, how to meaningfully co-design strategies and policies at organizations so that caregivers' voices are being heard, and also how caregivers can better interact with the Ontario health teams and provide feedback on what they're seeing on the ground as well. One particular toolkit for caregivers, care providers that I'd like to highlight is the Time to Talk toolkit. We've heard from a lot of care providers saying that they might know of caregivers coming into their space, but they're very patient or client focused. They don't really know how they can better engage with caregivers. So the toolkit really offers different tips and tricks on how they can engage with caregivers and support caregivers that might be coming into their workplace, right? So, for example, just off the top of my head, if a organization is focused on providing employment supports, but they know that there are caregivers coming into that space, right? What kind of things you can do to better engage caregivers? We're not asking employment staff or newcomer staff to be experts in caregiving, but just know what tools are available and where they can probably refer caregivers so that caregivers are able to get the supports they need as well. And then we also offer e-learning opportunities through the same e-learning platform for care providers as well. We know that Ontario's privacy and consent laws are really complex and sometimes can be a barrier to effective communication and conversation between a care provider and caregiver. So we've taken these privacy and consent resources that are available through the province, and we've kind of put them down in simple terms so that caregivers and care providers better understand their rights and responsibilities when it comes to caregiving in general. So
Was that
these are
ready?
available.
It's Mariana Greenblatt. How are you?
So these are available through our website as well. Feel free to go and check out where it says suite of 8 resources. It's linked on there for you to go and check out as well. And then lastly, we do work with caregivers across the province to garner feedback around different gaps in service that they're seeing. We have advisory panels, we have working groups, and different opportunities for caregivers to provide input and speak about their lived experiences as well. We recently launched our Caregiver Voices platform, which is a platform that enables exactly what I was talking to, different opportunities for caregivers to provide feedback. So if someone is looking to create resources that are caregiver facing, then we put those resources on the website so that caregivers can look at it and see how relevant it is towards the caregiver or how accurate the information might be. And likewise, if there are other one-off opportunities that come up through the provincial government, the federal government, the municipal government, then we make sure that we put those opportunities on the website for caregivers to provide feedback on. Or if there are system partners who are doing research with caregivers, we make sure that those information is also on our Caregiver Voices platform. Like for example, recently we had a focus group with caregivers looking at how what their experiences was around long-term care throughout the province, especially during the pandemic. So the governments of, and this was a federal call out looking at how long-term care service standards could be modified or changed so that things that happened during the pandemic wouldn't repeat itself in the future. So there's an opportunity for caregivers to provide feedback, for example. So these are different opportunities that do arise, and we put them on our Voices, Caregiver Voices platform. So if you're interested in providing feedback, please feel free to go and create a username and password, and you will be notified based on your preferences as well. Lastly, we have a newsletter, monthly newsletter for caregivers as well that you can go and access through our website, ontariocaregiver.ca/subscribe, where you can go and subscribe for the monthly newsletter for caregivers. Or if you're a service provider, we have a quarterly e-bulletin as well that you can subscribe through that same link, which will provide more information around the different kinds of caregiver initiatives that are happening across the province at different levels of stakeholder engagement as well. And then as promised, that is my contact information right there. My name is Shrid, S-H-R-I-D. And just feel free to email me. I know I covered a lot of information really quickly today. So if you have any questions 2 weeks down the line you really want to connect with me about, please feel free to email me and I will get back to you as soon as I can. I know I have about 10 minutes left, so if you have any questions, I'm happy to take on any questions at this time. Over to you, Zawar.
Thank you so much, Red. Really wealth of really helpful information, and we're seeing the feedback in the chat, and people really appreciated that. Thank you so much again for sharing all of that. And just to confirm that Shred's presentation has been recorded and will be available, so people will be able to view that. And Shred will be sharing, we will be sharing the slides that Shred has presented, as well as other resources that people will be able to follow up on, and that will include contact details as well. There is a question in the couple of questions in the chat. Perhaps, Shred, if we can get started with those, and then if there's any other questions, maybe you can take those. Just before we do, I'd just like to give people the opportunity to take a brief break if they would like to, 5 minutes, and then please do come back at 12:10, and we'll then do the raffle, and we will short evaluation and move into the breakout rooms. So there was a question. We will put the links in the chat as well, Archie. So there's a question from Archie here about define caregiver. I'm confused. Are you talking about professionals or family members?
Yeah, so as I said earlier in the presentation, when we at OCO, we work with family caregivers, so someone who is taking care of someone else in an unpaid capacity. Having said that, there are a lot of professional caregivers who are also family caregivers in their own time, right? So, and a lot of the resources that we have available for family caregivers, even if they are professional, can be used by professionals themselves. But we at OCO primarily work with family caregivers.
Thank you. There was a second comment and a question from Catherine. Fantastic work. I think that sums it up just really nicely. And then what advice would you give other provinces just starting to deepen their support of caregivers?
Yeah, so we are one of 4 entities across Canada. So that has a caregiver agency that's working towards caregiving needs in general. So BC has one, Alberta has one, Nova Scotia has one, and Ontario has one. So what we learned and how we were established, if I can go a little bit further back, is 2015 to 2017. There were multiple projects that were funded by the provincial government as well as the federal government, looking at supports for isolated caregivers in different communities. And unanimously, all of these projects came back saying, yes, isolated caregivers are not supported or don't have the supports, but caregivers in general feel that they don't know where to turn to when it comes to anything related to caregiving. So that was the catalyst for the Ontario Ministry of Health to do an independent research study through an individual called Janet Bede, who looked at the different kinds of caregiver supports that are available throughout the province, and then gave a report to the ministry saying that there needed to be that one entity to kind of coordinate these services throughout the province as well. Because primarily, and what you probably also see at other provinces, is that a lot of agencies, there are a lot of really great agencies doing really great work with caregivers, but they're not really speaking with each other. And that was a huge part of what we were tasked to do. And the helpline is one way of doing that. So we partner with all of these different agencies that have some sort of caregiver programming to make sure that their information is available on our helpline, so that if someone does call, if they're calling from Sudbury, for example, then the helpline is able to offer them supports based on where they're calling from, right? And say we have these 2 partner agencies in Sudbury who can offer you the service that you're looking for. So I think a great way to start is to start looking at what's out there and how you can really get that information in one place, so that caregivers can call that one place to access information. Because prior to OCO, if someone wanted services, then they will have to, go to 5 different places to access that information, right? So that's what we're trying to be, that one-stop shop for information and supports. I hope that kind of sort of answered your question. Thank you, Catherine.
Amazing. Thank you, Shred. Okay, so with that, I would just like to